Hello, friends. Welcome to this COVID-19 coffee chat on consumer experiences in isolation and quarantine. I am Catherine Kavanaugh, the consumer advocate with the National Healthcare for the Homeless Council. We're moderating today's chat. As communities are standing up quarantine and isolation programs, we're hearing a lot of advice from policymakers, administrators, providers, and advocates about how these programs should be run. However, we've heard very little from the people staying in these programs to understand what their experience has been and if these programs are meeting the needs of our communities. So the Council sent out requests to our members to speak with guests of these programs and held a series of interviews with individuals who are staying in isolation and quarantine to find out more about their experiences. So today we're going to hear from 2 such residences and then share the lessons from other interviews we've had about experiences in isolation and quarantine. The format for today's hour is going to be a coffee chat. We call them coffee chats because they are informal conversations. We invite you to get a cup of coffee, grab your lunch, and listen and discuss with us. This is an opportunity for us all to share ideas, challenges, and support for each other. We hope you'll engage throughout this discussion. One of the best parts of a coffee chat is getting to hear from people doing the work across the country. Some instructions on how you can engage in the chat today. We welcome your questions and stories throughout the chat. The more you engage, the better it will be. So if you have comments, you can type directly into the attendee chat pod on the right of your screen. Your comments will show up to all participants, and I will refer to comments and questions to the panelists as they come in. So please feel free to use the chat room as liberally as you like. If you're having any technical difficulties, you can call Caroline Gumpenberger at 615-200-6165 for technical assistance. But first, as we're getting started with this, we wanted to understand a little bit more about who is in the room. So I'm going to ask Brandon, our technical assistance coordinator, to pull up a poll about what organizations you guys are from. So if you can look at this poll and see what type of organization you represent, take a few minutes, let us know who's in the room. Okay, don't feel like everyone has answered, but it seems like we're still looking at pretty majority healthcare for the homeless programs, and then we've got some other service providers, policy and advocacy staff, glad to have you, and then some individuals from permanent supportive housing and isolation quarantine programs, so thank you. Our next poll we're going to pull up here is going to be asking you guys about what is your type of role within that organization. So just trying to understand a little bit about everyone's position and what perspective you're bringing to this conversation. So just wondering what your role is at an organization, clinician, administrator, government official, a policy advocacy staff, if you provide other types of services. Okay, it looks like we're slowing down here on the poll. And so it looks like we have a majority. Most of the folks here are clinicians, which is nice to have guys here. And then a little mix of some administrators and some policy advocacy staff and then other service providers. But glad to have you all for our chat today. End the poll and then move on to our conversation. So as I said, today you're going to hear from individuals sharing experiences with isolation and quarantine. So we have Bryce Word and Rodney Dawkins, who are both from Chicago, Illinois. They are staying at 2 separate isolation or quarantine units, and they'll tell you a little about their experiences in those stays. And then Art Rios Sr., who is our NCAB chair, the National Consumer Advisory Board with the National Healthcare for the Homeless Council. He's our chair, and he's been helping construct COVID villages in Portland, Oregon. And he'll share about what he's seen in Portland and what the experiences are like there. And again, I will be moderating this conversation from the council. So to begin this conversation, we just wanted to start hearing from our consumers about what their experience has been like. So I will pass it over to you guys. So Bryce, do you want to give us a little bit about what your experience was, learning you were going to go into quarantine, getting there, and what it's been like for you in quarantine? Bryce, go ahead.
Absolutely. Thank you very much. As I go into this. But first, on behalf of myself, the Executive Director, Best Neighbors, and staff of Journeys the Road Home, which is the agency that I am working with here in Palatine, Illinois. We certainly would like to go and thank and acknowledge the National Healthcare for the Homeless Council and their wonderful and capable representative, Catherine Kavanaugh, for all of the work that you have done on a national scale for being at the forefront of this when dealing with homelessness, and in particular with this COVID-19 situation that we are dealing with. We appreciate having the opportunity of being part of this forum, and I'm very glad to be here today. To go ahead and give some background before I start answering, to let people know about my situation, my ordeal of being homeless. This was a downward spiral that basically started in 2015. I had a job that I enjoyed doing that enabled me to sustain myself, maintain myself, be independent and whatnot. And that job was lost actually 5 years ago this month. And since then, I have been chronically unemployed since. To give you an idea of my background, I have 14 and a half years of government affairs, outreach, and external relations experience. I have a master's degree in communication from Northern Illinois University that I received in 2001. Needless to say, they have not been paid yet, and if things keep on going, they're not going to get paid soon. But it's just basically been a series of bad luck. Within my resume, ironically enough, I worked for a Chicago alderman for 2 years, and I was over senior and housing relations. And my job was to go ahead and to assist constituents that were elderly, disabled, and wait for it, they were homeless or had a homeless challenge. So that lets you know how interesting life can be sometimes. But even with that, just chronic unemployment, running out of money, running out of funds. I lost my apartment, moved into a house sharing program, and I had lost that in November 10th, 2019, Sunday evening, November 10th, 2019. And that's when I was involved, or my relationship with Journeys began, and I started using the PADS system here in Northwest Illinois. From that time up until now, just simply utilizing the PAD system, and during the day, doing the grind of the job search and putting out resumes left, right, up, down, sideways, and crisscross, and unfortunately getting more rejection letters than interviews. And so I was just simply plodding along until it was announced that COVID-19 is here in the United States, and it's time for people to undergo life-altering measures in order to try to have some safety. What had happened with us, as people probably may or may not know, the homeless community kind of has their own news network, and sometimes you have to screen what it is that they are saying, but it became known throughout the clients that there was going to be a meeting that was going to be held for us at one of the PAD shelters in order to find out if we were going to receive lodging while this was happening, and we had a chance to go and attend that meeting, and it was true. We was given instructions as to how we were to sign up, where we would be assigned, and things of that nature. So as of March 24th, I have been housed at a Red Roof Inn in suburban Chicago. I will say that prior to this, I was more of an Embassy Suites, Hyatt Regency type guy, but that has gone along the wayside. So I'm at the Red Roof Inn and very glad to be there. My first week, I had a roommate, and then he had to go ahead and go. And I had a single room to myself, which is the ultimate form of social distancing as far as I'm concerned. I had that for several days, and then I went ahead and got the call that I was going to be having a roommate in order to consolidate things. And fortunately, Journeys did a good job of pairing me with the right person. So that gentleman and I have had a fantastic relationship. It really has been a good thing. All of this has been made possible through a generous endowment that was given to us by the clerics of St. Viator in Arlington Heights, Illinois. They are a progressive, a prominent Catholic congregation who led the financial charge for this venture to go ahead and to take place. And as a result of that, other churches and agencies were able to go ahead and make contributions as well. With regards to our being fed, regarding our meals, the churches that were part of the PAD system have provided them daily, twice a day, breakfast and dinner. There's also a lunch that's slid in during the breakfast drop-off. In addition, we have been very fortunate in order to have corporate participation from entities such as Jimmy John's, Subway, Starbucks, and even Outback Steakhouse. And that definitely was a treat because I was able to go in to feel like a king for at least 30 minutes while I was having my dinner from Outback. So they certainly have been providing generosity to us as well. I am very glad to say that Journeys was conscientious enough on our health and provided COVID-19 tests. There was a weekend that we had not too long ago where all of the clients were tested, and fortunately everything at this point has come back fine with me and have been able to continue to move forward as we go through this. In closing, I believe that we will be housed until mid-June. I have not heard that officially, but that seems to be the word among the clientele. One thing that we do know is that we will be given a 1-week notice as to when our release from the motel will happen. With regards to me, still job searching, still being told no. So that seems to be the consistent thing that's happening right now. I did, however, I've applied, and I have not just limited my search. I've been applying to the essential employees, the essential stores, things of that nature, just so that I can have some type of income that's coming in. I went in, I checked my email today, and I applied to Home Depot, and the location got back with me. So we'll see where that goes, but just continuing to go ahead and to plow through this as this pandemic is ongoing. So we will see, or moreover, in fact, I will see. So at that particular point, we hope to move forward and be able to make progress. Thank you so much for listening.
Thank you, Bryce, for sharing your perspective. And Bryce, you were preemptively housed in Chicago to stay away from coronavirus, which is a great model that you guys were able to find through funding sources. Now we'll go and hear from Ronnie, which had a different experience being isolated after COVID. So Ronnie, do you want to share about your experience?
Hi, everyone. My name is Rodney Dawkins. I'm the former NCAB Steering Committee Chair out of Chicago, Illinois. My life changed these last month on April 28th. I went to the hospital to go into the behavioral health ward, and while I was at the behavioral health ward, the hospital staff asked me, did I want to take a COVID-19 test, and they came back positive. So from there, I stayed at the hospital for 2 days in isolation. I was able to eat meals and get rest and things like that and do the things that I needed to do. It was just that, they wanted to make sure that, I was not around anyone else because they didn't want it to spread. I am so grateful that they took the test because I didn't know that potentially I was COVID and asymptomatic. From there, I talked to the therapists and other staff and case managers, and they connected me to a quarantine site where they provided 14-day stay. I was able to wash my clothes and things like that and shower and get meals and also take my medicines because I'm diabetic as well. So I stayed there 14 days, and then I was connected to another safe space where right now, that's where I'm at right now, until it's time for me to go on with other things that I like to do. So currently I feel great. Like I said, I'm glad that the hospital was doing testing. I think prevention and testing and education piece is very important. Wearing the gloves and the mask and things like that. Social distancing is a part of that prevention, and I think that needs to continue to be a part of COVID-19 and making sure that we keep this under control. So I'm doing great. I feel well, and I thank everyone for the encouragement and support that they have been giving me through these times. So I'm Rodney Dawkins, and thank you so much for listening. And that's all I have right now.
Yeah, thank you, Rodney. We were all very grateful that you were luckily asymptomatic and now you're out of quarantine. So glad you're back in the world with us.
Thank you.
Art, you want to share about the experiences in Portland?
Yeah, hi everyone. This is Art Rios. Like Catherine said earlier, I am the National Consumer Advisory Board's current chair of the NHCHC. My experiences have been a little bit different. A little bit of background of myself. I'm someone with over 20 years lived experience on the streets with poly use as well of drug addiction, alcohol, and things of that sort. So my body has been torn down in so many different ways to where I should be very susceptible to this coronavirus. And the one thing is that, you know, now being clean for the last 13 and a half years, it gives me a chance to like really look at things, but I'm very susceptible to these. So what we have been doing here in Portland, Oregon is we have put together some villages. They are a COVID-19 safe and social distancing village. We have 3 sites that are a combination of folks. One of our sites is our LGBTQIA plus with folks with disabilities. There's about 28 spots there. We also have our BIPOC, which is our Black, Indigenous, people of color. But what we also have is 4 white ally champions who also work with our persons of color who speak Spanish only and are very trusted by these 4 white ally champions with our immigrant workers. Then we have one other, which is our mixed village with everybody. So people with disabilities, BIPOC, LGBTQ. Some folks look at it as infinity groups, and we know these are some of the folks that have a hard time getting into housing or to isolate. So these campsites are about 12 to 22 feet apart from each tent. And we look at it as we just have like a few rules, and some very simple rules is, you know, when coming into the village area, we ask folks to wash your hands when you come in, make sure you're wearing your mask, keep 6 feet for that social distancing from one another. Don't line up when we decide to feed you at the times that we have. And the amenities for folks that we have is almost like just you and me being at our own home. They get showers, they get towels, they get hygiene items, they get 3 meals a day, breakfast, lunch, and dinner. Sometimes folks come by, bring snacks. We have about 3 to 5 computers on each one of our sites that was donated from one of the organizations, Free Geeks, that has donated computers so people can still look for work, as we are one of 33 counties that have not opened up yet, but we look to open up soon, hopefully. We give out socks, we give them toiletries, we have porta potties, we have hand washing stations, we provide coffee, tea, snacks. Also, we have a charging station for folks to be able to charge, as we know that most homeless folks that are out on the streets doesn't have that availability to just charge your phone. Like I said, we have porta potties. We have about 6 of them. 2 are for people with disabilities in each site. We have garbage and recycle as well. We just looked at this village model concept as something very doable, very workable, and to get them to be self-sufficient enough to be able to run like their own village council, to do some of these positions that we have of watching the front gate. So you'll be part of the gate crew, Sanitation group, someone who sanitizes tables and chairs and the fence and the porta potties and the door handles. We also have food sanitation, where someone is able to clean up the area when food comes in. Then we have where you could also be the food person to be able to pass out food. But like I said, we try not to have people line up, but we do walk around, let people know that we have food, and we'll actually bring it out to you. So each one of our staff there make sure that we are also washing our hands, putting gloves on, wearing our masks, providing them with this food. But one of the biggest things that we also look at is that when people leave, we give them hand sanitizers, an extra mask if they don't have a mask, to be able to go out. We're always educating to folks that make sure you're watching who you're around. You know, they talk about everybody needs to have these contact tracers and stuff like that. Just know your surroundings, where you're at, what you're doing, you know, and it's just that educational piece. I'm a freelance homeless advocate that still does ground level work at street levels where folks are either in their cars or in tents or on a cardboard box. It's a human thing to stop and talk to somebody and educate somebody, give them a mask, give them hand sanitizers, just so they know that, you know, this COVID-19 is here. It's here for a while. But if things are awry, we have a whole lot of different groups. We have Portland Street Medicine, which is a group of volunteers that come from multiple different hospitals that go out and check on folks. And if we find out that, you know, someone has a high fever or pretty sick or hard breathing, we get them situated with the right folks and get them into isolation. Right now we have about almost 500 hotel rooms that are helping folks with symptoms. Even if it doesn't look like it's a very high COVID-19, we are still getting some folks that are in that are pretty sick that need to be off the streets for a while. Our cases here within our homeless population is 8. Out of, say, 14,000 people that we feel that are on the streets, we have only came and have found out that we only have 8 people with lived experience on the streets who've actually contracted the COVID-19. Out of those 8, 5 are doing better, 3 are still in the hospital, and 1 of them is on a ventilator. So within our organizations that we're doing a lot of collaborations with one another, we're just trying to make sure that education. Just get out there, talk to folks, give them hand sanitizer, give them masks, and educate them of their surroundings, the people they come in contact, because that's one thing that's going to help save their lives. Like my partner tells me all the time, you know, stay in, stay home, stay safe, stay alive. And I just look at it that, you know, for me, I'm very susceptible to this as being a diabetic, but I still go out there and I still help folks at ground level. Once again, this is our Rio Senior. Thank you. Hope to hear your questions.
Yeah, thank you guys for sharing those experiences. And Art, I really love and appreciate the idea that people are allowed to leave these COVID villages, but when they are, they're given resources to do so safely and given hand sanitizer and masks to leave. I love that idea. So now we're going to get into kind of our questions section and talking a little bit more in depth about the processes of how isolation quarantine operates. So I know, Bryce, you shared a little bit about that there was some word on the street about a possible potential move, and then you heard at a meeting that you would be going into a hotel. Can you talk a little bit about what the process was like between learning that you would get a hotel room and then actually getting to the space?
Yes. Fortunately for me, I do have a vehicle, so I am very happy that I have the mobility to get a chance to move around and things like that. As I had said, members of the community had said that first it was going around, well, Journeys is going to give us hotels, And it was like, okay, maybe they will, maybe they won't. I need to go in and hear this directly from an official source. And then a short time after that, they said, we will be meeting at the First Presbyterian Church in Arlington Heights, Illinois, which is one of the key PAD shelters in the system. It was a 1 o'clock in the afternoon meeting, if I recall. People started to go ahead and go to the church. And once the majority of the people were there, then staff from Journeys went ahead and confirmed that we were going to be housed in a motel. There's actually a couple motels. There's the Red Roof Inn that I'm at, and then there's another one that is immediately behind us. We were told to go ahead and pick who you wanted to have as a roommate. There were also some other considerations, if I recall correctly. There were some other considerations, I believe, for families and people with disabilities. If you were on a list for individuals that fit that category, in addition to the elderly. Otherwise, people were told to go ahead and to pair up. And then we went ahead and we signed off on documentation. We were given rules and regulations with regards to how our conduct was supposed to be at the hotels, signed off on everything. And then we were told if you had a vehicle, which I do, to go ahead and to meet at the hotel at an appointed time so that you could go and receive your room assignment, meet up with your roommate, and then just go ahead and proceed from there.
Nice. And do you think there was anything that could have improved that process for you about communication or feeling safe, or did you feel pretty good about that process, or anything that would have improved it?
No, I felt fine the way that it was. Certainly, something that was very impressive was with those who did not have transportation. Staff, I thought, of course, I'm not in that group, but I thought they did an excellent job of trying to go ahead and to coordinate how to get people to their lodging and organizing that, and they had a tough go at it, but they was able to go ahead and pull it off. But from my standpoint, it was pretty straightforward, and then we were given our assigned rooms and then just proceeded from that point.
Nice, yeah. And I want to share, I heard similar stories from interviews I conducted about people who were taken to isolation units. The staff were then given or brought their things to them, went back to the campsite and brought things to them. And I heard a number of those sort of stories where either staff or organizations were really thoughtful about making sure that people had everything that they wanted to bring with them to the hotel. And so I think I'm appreciative that that was in your case as well. And I wanted, Rodney, you talked about there was the importance of testing for how you found out. You were asymptomatic and went to the hospital for something else, and so you would not have known unless you had gotten tested. So wondering, a question from the chat room here, if you guys have seen any reluctance from people to get tested, and if you're seeing some reluctance to get tested, what communication strategies have been effective in order to get people to test?
No, I have not. I didn't see that while in isolation or in quarantine. All the participants that were there were very cooperative with whatever staff was asking. But no, I didn't see any reluctance. I didn't see that at all. I just think that everyone worked together, and it was great. I'm so grateful that the medical staff, all those different medical entities are working together. No, I didn't see any of that. No one was negative or reluctant to do anything. So they cooperated.
Love it. Art, on the ground in Portland, has there been any reluctance to test?
What was the question again?
Have you seen any reluctance from people to get tested? And if there's been any reluctance that people don't want to get tested, have you had any strategies that have been effective in getting them to test?
Actually, with the testing abilities, like we were just like everybody else, where it took anywhere from 10 to 14 days to get it back. Now that they've set up some areas for folks to get tested, testing is coming back anywhere from 2 to 4 days. One of the big things, like I was saying, for us to open up is these contact tracers, and we're at about halfway there to be able to reopen back up. They just want to make sure that we have enough people to be able to talk to the folks that have. But I think it's been a great opportunity for folks to actually go in and ask to be tested to make sure that they don't have it, or if they do, what the next steps are. And a lot of our clinics are urgent cares, our HCHs, our regular hospitals, our emergency departments have all done the same thing. Minimal people within their lobbies, social distancing, making sure asking folks if they would like to be tested or not has been pretty good. A few weeks ago, not as many people wanted to be tested. So I know right now at some ground level stuff where I'm working at ground zero of homelessness, folks are starting to be tested. And, you know, people were talking about how much money it was going to cost and why should we be doing this or why should we be helping folks. And it's just the reality of, if we want to reopen, we want to make sure that everybody is being tested that wants to be tested, but we're not going to push anybody who doesn't want to be tested. So it's just having that human interaction, that authentic relationship with your folks. Just asking and educating.
Yeah, fair. Talking to people, finding out if they are reluctant, what the reluctance is, why they're scared of it, and just talking with them human to human. Love it.
Just being a human being to another human being, because you know, there's so many conspiracy theories out there, and people think, oh, if I take a test, I'm going to be tracked. If I have the COVID virus, then they're going to, you know, give me a vaccine where they can track me, and, you know, all these different things. So, you know, it did scare people, but also at the same time, hey, people, you know, stay in, stay safe. If you go out, cover up, take hand sanitizer, but also at the same time, if asked to take the test, just take the test and make sure you're healthy.
Yeah, thank you. And Rodney, I know you said you went into the hospital not knowing that you were going to be quarantined. So, and then you stayed there for 2 days and then were moved to another unit. Can you talk a little about that beginning experience entering the program, how you felt and how you were supported, if your belongings were brought? Can you talk about your process entering and moving through 2 different quarantine units?
Yeah, entering into the quarantine. Well, you know, the staff, while I was at the hospital, they would call me, like the therapist, the case manager there, and the psychiatrist. And then the nurses came in to make sure, they explained to me what was going on and how I felt, you know, was I still having racing thoughts, you know, how I felt about going through the next phase. And they provided the transportation. Matter of fact, they came and they were already there an hour earlier than the time they were supposed to be there. They were supposed to come get me before. They came a little bit earlier. And so the experience was great. Like I said, I just think the staff was very professional. They were very prompt. Just everything that they did, everything that I needed, they came to make sure that, you know, I had it. So the resources was there. The training of the staff was there. I just, going into the quarantine, the hospitality was great. I mean, I have to say the food always good. Breakfast, lunch, and dinner was just great, you know, and I had no problems being there. I just thought they did a wonderful job with, you know, bringing people there, making sure people, when they left, they had somewhere to go. That's another thing that I like. They made sure that each participant had somewhere to go, and they made sure they got there. You know, they provided the transportation. So anyway, it wasn't no problem for me. The only thing that I still have something in the back of my mind, I would like to be, you know, just retested to see where I'm at. So, you know, that's the only thing that's the only gripe that I have. You know, I just want to be retested. So that'll probably be coming up in the next week or so. But yeah, everything is great here.
Yeah, so talk a little bit more about, your guys' support during the stay while you guys were in quarantine units. I was just wondering, like, what supports were provided. I mean, you guys both said you got pretty decent meals, which is great. But just wondering if there was availability for some case management or mental health services, behavioral health services, or seeing a provider. Just Any other supports while you guys were in isolation? What supports were provided for you guys?
Yeah.
Rodney, do you want to go first?
The case management. I met with case management once a week. I talked to the therapist over the telehealth and the psychiatrist. And then they had nurse practitioners there who would come in, they would talk to us and, ask us questions about how you feel overall, do you feel like you're going to do something to yourself or someone else, stuff like that. So, yeah. So I met with the therapist, let me see, I think it was like every other day. I talked to her, and then the nurse practitioner, I saw her maybe 3 or 4 times out of that time that I was there. I was there for 14 days. So, I saw the medical staff and the case management therapist. I saw them quite regularly.
Yeah, I appreciate it. Yeah, they seem like pretty frequent check-ins. I know from some other conversations I've had, most people are providing some sort of supportive services in there. I only heard one person who had been in isolation and quarantine for 8 days and hadn't had a staff person connect with them yet, and was a little frustrated by that. But I think for the most part, what I was hearing is that people do feel like there are supports provided. Bryce, do you want to talk about what supports were provided for you while you were staying at Journey, or while you are staying at Journey since you're still there?
Right. Staff has been very open and flexible with regards to their availability to clientele. The staff here, they are on rotating schedules so that they can go ahead and try to maintain the social distancing in the office. My counselor, her name is, or my caseworker, her name is Mandy Smith. She's absolutely fantastic. And she is also our vocational coach as well. So we have been working very close together in order to try to get myself some employment to maintain things after our dismissal. Like I said, staff, they have their own days of the week that they are assigned to work. You are also able to reach them by phone or by their email in order to do that. I have met with Mandy a couple times, just simply scheduled an appointment in advance to get a chance to go in to see her, have whatever conversation it is that we need to have, and then go. But certainly they have been, my experience has been flexibility and openness in order to go ahead and meet your needs.
That's great. And I love that you guys are still in the case management work, still have the vocational support going on. We're sending out good vibes for your future at Home Depot and beyond, so appreciate that. Art, I think you had mentioned that you guys had put charging stations up in COVID Village. I wonder if you could talk a little bit about how you guys got access to charging stations and how that's being implemented.
So the city had come to the coalition and talked to one of the organizations that asked if they could put these villages up and help social distance. As we seen that some of our rec centers, our convention center had opened up, and so what had happened is that a bunch of organizations got together from the city's ask to put things in place. So one of the organizations that came out was our big event crew from Hollywood Lights. Throw a plug in for them. But they came in and they brought the power, and they brought in surge protectors, and so we had power to put those together and charge the computers that we got from Free Geek, another plug-in for another great organization here, which is a nonprofit. So all these different groups come together for H2 Oregon is our water supply. So we have fresh water that comes every 3 to 4 days, bottled water, our porta potties, things of that sort. It was just all these different organizations was asked by the city to come in and support these village models to put things in place. So it felt like someone was at their own home, the self-isolated, if need be, into social distance. So things were put in place, and especially these charging stations, these people who live on the streets and, do odd jobs or stand on the corner and ask for spare change. are still some people that are very responsible, because it's that stigma that people will say homeless people are drug addicts and they're dirty and this and that, but they're just regular human beings just like the rest of us that are trying to survive. So they keep their phone service so they can connect with families and friends, because everybody has to do this social distancing. So yeah, there was a lot of collaboration from the city and one of the organizations, and then a coalition was put together to do this. The only thing I could say is that homelessness is going to be ramping up here very soon here in Oregon because a lot of people are not able to go back to work yet. So we have this rental moratorium going on. So like after the state of emergency, you have to pay back your rent after 6 months. So it's going to be really, really hard for a lot of folks. So we see a lot new homelessness happening. And what does this new homelessness look like for folks that have never been homeless? So we're trying to put a lot of things in place. So just with these charging stations is just 100% a way to make sure that people can still connect with work, connect with family, connect with, like I keep saying, that human being on the other end, just to, alleviate mental health, trauma, addiction, just to be able to call somebody and say, hey, hi, how are you doing? It's a model that's been around for a very long time, and we're trying to do it in a way to where charging your phone to connect with somebody is not a human right, but a human authentic relationship with folks on the other end to say, hey, I'm okay, I'm not negative, I'm still doing well, whatever it is,
Yeah, thank you, Art. I think that's so important when we're talking about what supports are being provided during this day. I think we all know how much relationships are important to the healing process, and we have to make sure that we're providing opportunities for people to connect with each other and also move forward in their own stability and exit homelessness. So yeah, connections to phones, Wi-Fi is terribly important. I heard another story about case managers helping get people access to phones. So making sure that everyone has access to phones and Wi-Fi and internet while they're in isolation quarantine, I think is an important piece of being supportive of people in this day and age.
And that was one thing I forgot to say is also we connected with one of the companies within the neighborhood, and they set us up with Wi-Fi connection. So that was a great way to a random company within the neighborhood said, yes, we're willing to help you so you have Wi-Fi, so you can get on your phone and still connect with people and Facebook and call family and friends. So that was nice that a for-profit company says we're willing to come out and help a nonprofit company take care of the folks they need while dealing with COVID-19 and social distancing. You rarely hear those stories, but that was great to hear that this company wanted to do that for folks.
Yeah, and I think that relates to Bryce's conversation about most of their program being funded through donors and good connections with businesses. And so I think remembering for programs who are trying to think about how to build up these programs or strengthen their isolation quarantine programs, that looking at what community resources there are in terms of businesses or donors or contacts, looking at your community. We're all in this together with COVID, and people are acknowledging that, and so try to tap into some of those resources. Okay, now I want to shift a little bit about the process of leaving isolation quarantine. I know, Bryce, you said that you are still there, and hopefully they will give you 1 week, or they've said they will give you 1 week before you have to exit. Do you have any concerns about where you will go after when you exit, or how are you feeling about the process of leaving isolation quarantine?
Very anxious. At this particular point, I do not have any solid arrangements whenever the other shoe finally drops. That's why this thing with Home Depot, I'm not a gambling man because I'm not the luckiest person in the world, but hopefully if things go well, ideally, which with recent interviews that I have had, they have not, the income that I would receive, and if the hours are available, that might give me a fighting chance to go ahead and to stay at the motel that I'm at currently or at another place. Now, like I had said, the gentleman and I that I am rooming with, we have gotten along very well, and I went ahead and I threw out the idea when we are dismissed from the motel, would you like to go in to see about pooling our resources? Initially, he has said yes. We've kind of discussed that back and forth, but everything is going to be contingent on if I can try to get some type of adequate employment, ideally before we are let go from the hotel. So right now, I'm in a huge void, which feels terrible, to say the least. But that's pretty much where I'm at. So I need some type of income to help me, and it's going to be more than just the motel. As Art had talked about the phone, I have a phone as well, and that phone bill is still going to be coming in. I still have a note to pay on my vehicle, in addition to a couple other things as overhead. So it's a black hole that I'm looking at daily when I think about it, and just trying to figure out what in the world can I do. I hate having all my eggs in one basket, but that's the basket I've been given.
Fair. So similar to COVID hasn't really improved any of the chances of finding housing or finding support these days, and so still the same struggle it was before to find housing and resources.
They did a wonderful job.
Rodney, I know, Rodney, you said that you left your quarantine, so do you want to talk about the process, how you found out you would be leaving and where you would be going, what that was like learning about your leaving and how you left?
Yeah, sure. So the case management team was working with me extensively to make sure to wherever I went that it was a safe space and it was a space where I could be around individuals and I continue to work on getting better. So I was, let me see about what, maybe 8 days past my stay. One of the things was because my medication, I was having problems getting my medication. So they wouldn't let me leave until I got all the things that I had, and that was one of them because the pharmacy said that they couldn't find my card number because I have a different insurance now. So that was the holdup. But the case managers worked with me and provided, they got someone to take me to where I am now. So right now where I'm at now, I'm doing great. I love it. I said they did a wonderful job. And like I said, the holdup was because of my medication. I wasn't able to get it. So that agency, particular agency, took up the bill for that particular medication, which was they wanted to charge me $500. So yeah, so it worked out. So it worked out, yeah. So I'm glad that, like I said, I'm glad that staff there, they're just awesome.
Yeah, and I'm happy the hospital kept you to make sure that you had everything you needed before you were discharged, so they could make sure that you were healthy and that the new place was open to being so amenable about when you would come in and letting you in after leaving quarantine.
Right.
So thank you for that. So now I want to shift a little bit of gears, and as we're wrapping this conversation up and just thinking about how we move forward. So I'm wondering, we've had some conversations here about your feedback and your thoughts about isolation quarantine, but I'm wondering for other programs, how do you think that they can be talking to their guests at these isolation quarantine or getting their input into decision-making processes? So programs can be hearing from consumers about what's going on and how they can improve. So what are your ideas about how, what lessons we can give and how to provide input into the decision-making process? So Art, do you want to take that one first?
I would just say just ask them their needs and wants, what they need to be very supportive after or, before quarantine, during quarantine, after quarantine. Everything always changes for someone, and you never know. It could be like Bryce. He's not for sure where he's going to go next. So, yes, that could be where am I going to go? Ask that question, where am I going to go after quarantine? Because that really helps ease that person's vulnerability and the trauma that they're going through. Like, oh, my goodness, I actually caught COVID-19. What am I going to do? I'm going to be isolated away for about 2 weeks, maybe 3 weeks. Who knows? But it's just asking those questions, like, what supports do I have? What supports can I get? Or with folks on this phone call, like, what supports does the capacity of your HCHs or the capacity that you have to help somebody after quarantine? Because even also after quarantine, and they're somewhere, there still needs some housing stability to keep them in until you can find some of those solutions.
Yeah, and I would say for other people I heard, asking people not only in the beginning when they get there what they need and what supports they need, but asking that maybe a couple times, every couple days or once a week or so, but asking that question a few different times because things change so much with where people's brain space is at and emotional state is at and just what they need and want. I heard from a few people that they had some check-ins early, but then it kind of dropped off and they would have preferred kind of a more continuous contact. So as often as you can be asking people about what they are needing and what supports they would like. I think that's optimal. Bryce or Rodney, do you have anything else about how we can be asking guests about how to improve isolation and quarantine units?
Well, now with the telehealth and the Zoom going, and I think that's great. Just asking the consumers, through like a survey. I was going to say, like the survey we were doing in the past on the steering committee. That was one where we did on health, and there was one we did on some. But anyway, get a group of consumers to be on certain calls with the administrators to see what areas that we can cover that's not been covered, so we can get the word out to the people who need masks and who need gloves and just keeping the consumers at the table while the administrators are having a conversation on how we can minimize spread of COVID. That's what I would like to see.
Yeah, I like that idea. Program administrators are having discussions about what to do and moving forward. Invite consumers to those meetings or try to go back to them and provide a survey, ask their feedback on programs, have a little tab meeting, go back to the isolation quarantine and talk to the folks at a safe 6 feet apart distance about what they are needing and what they're experiencing.
Right, correct. Well, through like we're doing now, if that's possible.
Yeah. Bryce, anything to add?
I think I would go ahead and piggyback off of what Art and Rodney has said. In my particular situation, I am very proactive in reaching out to my caseworker. We are usually emailing at least once, maybe twice a week. Of course, I have been able to go and to schedule face-to-face appointments with her with no problem, and she's asking the standard appropriate questions. How are you doing? What's going on? What do you need? Et cetera, and so forth. So I normally keep in regular contact with my caseworker simply because that's what I do, and that's how I am. But I would definitely go ahead and concur with the comments that Rodney and Art have offered.
Thank you. And the last big question I wanted to ask to you guys is just kind of thinking about how we move forward. A lot has changed with coronavirus. We've seen different policies come down and just reassessing, looking at the structural inequalities that have helped cause such damage with the coronavirus crisis. We've seen the health disparities come out and continuing police brutality and structural racism alongside the COVID crisis. We're continuing to see an underfunding of housing that we know we need and still lacking a single-payer healthcare system to make sure that everyone has fair access to healthcare. So just kind of wondering from you guys, in all that we have kind of seen and experienced from COVID, are there either resources or things that you have seen provided to you or seen provided in the community that you think we need to expand on to move forward? Successful strategies in addressing COVID that we should expand on. So just wondering, as you're thinking about moving forward, what lessons have we learned from COVID? Rodney, do you want to go first?
You said what lessons have we learned? Well, from what I've seen, it's just a lot of great medical staff and HCH and other professionals coming together to make sure that, they're saving lives and make sure people are healthy and they can access health care more easily. So yeah, that's what I've seen from being down on the ground. Yeah, from the mobile unit, working with another entity, and they're going out to test and to do things similar to what Art is doing out in Portland, and going to the cabinets and making sure that they have what they need and taking them back to a facility so they can have somewhere to stay during their quarantine. I think that's continuing ongoing.
Yeah, I think you're right. It's just continuously the importance of health care and how wonderful our healthcare HH community is, but when we think about health care, how broad we need to think about that, and that needs to include thinking about how people have access to the internet and phone service and showers and mobile showers and kind of some of these resources that we're providing now to these COVID encampments that we should be providing to people all year long that really help improve life quality.
Correct.
Art, do you have any lessons about what you've seen that works that we should continue to expand on?
I think what I see that's working is that, yes, we are number 33 counties here, and we're number 33 and we haven't opened up. I think a lot of people have learned to see what social distancing is, what reopening is, but also understanding that there is this whole other life that's on the street, which is called homelessness, and that they're understanding that there's a connection of still needing help, still needing, resources for folks, knowing that we don't have a lot of money, knowing that, budgets are being cut, and they're still trying to, get some of this stimulus money that's coming in from the government to make sure that we're filling those gaps, but also understanding that, it may be harder for those folks that are inside. And like I said, we may have this new homelessness that looks way different than what we've been experiencing over the last 40, 50 years. But I think what I've seen is that, utilizing space to help people within the area, within a campsite, a rest area, a COVID-19 social distancing safe space, to where people are utilizing the same things they have for like they would at home. But I think building some of these and the businesses understanding that this may be the new norm for a little bit until the economy gets back to normal. But what is normal during COVID-19? Every day it's constantly changing. Every day more and more people are on phone calls and trying to talk about solutions. But the solutions is talking to the people at the ground level of what their needs and wants are, because it may not be being in an apartment or being in a house. It may be that safety on the street as well. So that's what I see.
Yeah, thanks. Rodney, can you mute your phone?
Oh, okay. All right.
Yeah, thank you, Art. I think that's a good perspective, is that there's an opportunity here where we're having a lot of different conversations than we've had, looking at the state of what is normal and how COVID has changed normal and just what it means to have housing and healthcare and what that should look like. I think we're all assessing kind of a new normal and how we move forward. So I think that's a perfect note to kind of end us off here on as we're closing up this conversation, is just thinking about how we can move forward in a way that has respect and dignity for everyone and make sure it includes the perspective of those with a lived experience. So I want to thank very much our presenters today, Bryce, Rodney, and Art. Thank you guys for sharing your stories and your experience with us. This was a great conversation, and I deeply appreciate sharing it with you. So I will thank you guys, and we will end the webinar for today. Thank you.